Aggrenox is a combination medication that contains two active substances, aspirin and dipyridamole. Aspirin is a nonsteroidal anti-inflammatory drug with antiplatelet properties, and dipyridamole is a platelet aggregation inhibitor. Together they work to reduce the risk of blood clot formation. Indications. Aggrenox is indicated for the prevention of stroke in patients who have had transient ischemic attack or ischemic stroke of embolic origin, recurrent stroke in patients with a history of non-cardioembolic stroke. How to use. The typical dosage of Aggrenox is 1 capsule containing 25 mg aspirin and 200 mg dipyridamole taken orally twice daily, with or without food. The capsules should be swallowed whole with a glass of water. Do not crush or chew the capsules. Contraindications. Aggrenox is contraindicated in the following cases: hypersensitivity or allergy to aspirin, dipyridamole, or any of the components of the medication, active peptic ulcer disease or history of gastrointestinal bleeding, hypersensitivity to nonsteroidal anti-inflammatory drugs. Special instructions. Aggrenox contains aspirin, which increases the risk of bleeding. Caution is advised in patients with bleeding disorders, recent surgery, or concurrent use of other medications that increase bleeding risk. Aggrenox should be discontinued prior to elective surgery to minimize bleeding risk. The decision to discontinue should be made in consultation with the healthcare provider. Inform the healthcare provider about all medications, including over-the-counter drugs and herbal supplements, as some medications may interact with Aggrenox. Side effects. Common side effects of Aggrenox may include headache, upset stomach, diarrhea, dizziness. Serious side effects, including bleeding events, are possible. Seek medical attention if any severe or persistent side effects occur.